was inspired to write this book because I felt like there was a story that had to be told. Day in and day out, I see how poorly our medical system works for those who are suffering with chronic pain, and I felt like this was an opportunity for me to try to really make a difference in people's lives. I bring to you many examples and case studies of where people start off with chronic pain, the limitations that they have with the medications that they take, the bad effects it has on them, and I see people make dramatic changes in how they manage their lives and in their health and well-being. We now know that the most effective and powerful tool that each and every one of us has to establishing great health, including managing our pain well, is our own selves. Our brains and the way we think is our #1 healing tool, and it's the best treatment that we have to effectively manage our chronic pain, feel better, and decrease our suffering. And if we use that effectively, we know that we can effectively manage our pain much better than we can by relying on anything else the doctors can do for us. And many times that includes medications. Imagine you have high blood pressure and you go to your doctor to get help, and he puts you on a medication to control your blood pressure. Now imagine after a while, not only does this medication stop working to manage your blood pressure, but it actually makes it worse and your blood pressure starts to go up. And new research has told us that when patients, in some cases, who are on opiate or narcotic-based medications for a prolonged period of time, that their pain levels actually get worse. Not only does it stop managing the pain well, but they can actually start to feel more pain. In my book, I bring up a very controversial topic, which is the way pharmaceutical companies can over-influence the way pain is managed. I bet you never thought that your pain was the focal point of numerous Wall Street companies, corporate takeovers, kickbacks. Your pain is big money for somebody else, and there's somebody who's making a lot of money off of your pain right now. Fear and stress have a huge impact on people dealing with chronic pain. When we become injured and we're in pain, we're almost afraid to move, to breathe, to do anything. We need to go through a process of learning where that fear lies, where that fear of re-injury is, and come up with a plan on how we can gradually work through that, get past that, so that we become active again and functional again and start to enjoy our lives again. When you start to learn about the lives of other people who have gone through some of the similar experiences that you have, and you've seen the way they have overcome their chronic pain challenges, and when you can start to relate to what they've experienced, that will give you hope. Inactivity is one of the biggest, if not the biggest, health problem that we have in our society today. The body's meant to move, and the less it moves, the more it hurts. In my book, I give you a top 10 list of exercises that I think you can do. Squatting is very important to live a functional life. Push-ups allow you to develop strength throughout the body, from your core muscles to your spine to your chest and shoulders. The third one is walking. It turns out we don't walk enough anymore, and the more we develop our walking, the stronger we get, the healthier we are, the better our body works, the better our cardiovascular system works, and ultimately, the healthier we become. The #1 tip in my book is that you are your own best healer. There is no doctor, there is no pill, there is no surgery that can do more for you than you can do for yourself. And this book takes you through a process, step by step, of how you can learn the skills that will work for you so that you can do that for a lifetime.